Dear friends, today is a happy day because this Saturday, 11th November 2023, we have finished very interesting. All should know that. So today topic is very important. The thing we are going to deal with the moment of the supravocal tract. So everybody in the world know and think that vocal cord is the voice box. But still we feel it is a misnomer because supravocal tract, the tract above the vocal cord only produce voice. Vocal tract, vocal cord only make the sound. So the important thing is articulation. That is the main important what we are going to deal today. Organ which produce speech sounds are called as articulated. So organ which produce sound, speech sound, speech sound should be created. That is called articulator. In the supravocal tract, there are two types of articulators. One is active articulators and another is passive articulators. Active articulators are tongue and lip. So it actively moves tongue and lip. The important thing is soft palate and uvula that is left in the recent literature. So we are going to include very much the uvula and soft palate as an active articulator. We are bringing very important thing in what way the soft palate and uvula make sound. Passive articulators are fixed articulators. That is tooth, hot palate, and other thing. So tooth is also articulator. Okay. Hot palate is articulator. That are all fixed. It is not moving. The moving part is very much required for making words. We know that how lip moves. Similarly, now a revolution had come with the introduction of functional MRI. Most of the cases we are doing a functional MRI study of the uvula. We know how much movement it makes. What are the movements it makes in each words when we pronounce. So the functional MRI is a great learning for us. And here we want to assess the functional capacity of the uvula. So uvula is a moving organ in the posterior end of the soft palate, which is hanging like a grape. It is not hanging like a grape, it is just like a tongue. Here the important thing you have to know, this supravocal tract is two portions. One is oral cavity and another is pharyngeal cavity. That also you are missing, that nasal cavity is also there, sinus is there. Here you have to find out oral cavity is there like this, and laryngeal cavity is vertical. So two portion, very interesting. Human being, we are having a erect posture. Because of the erect posture, there is an angulation, mouth cavity and pharyngeal cavity. We'll be able to appreciate very well how the mouth cavity is this, and pharyngeal cavity is there, and one another cavity is there above that is the nasal cavity. So this angulation forms when human beings had attained erect posture. So after attaining the erect posture only, we feel the human beings develop words, and because of good articulation. In animal, it is almost straight. There is no angulation at all. Human being, it is angulation. Animals, it is almost straight. Oral cavity and the pharynx is in a straight line. How wonderful it is. See, this we have given in our book also with great demonstrations. So this angulation is very, very important for production of sound. In what way it is important mean? That is the work of the uvula. Uvula is at the junction. Here comes a foramen in the palate called as lesser palatine foramen. Lesser palatine, we have dissected many cases and seen what is the action of the lesser palatine, where the lesser palatine nerve comes. What are the structures, tissues, organs supplied by the lesser palatine nerve or posterior palatine nerve? It is also called as posterior palatine nerve. It supplies the soft palate, tonsil, and uvula. So this is very, very important for us. Why? Mean we can palpate and see where is the lesser palatine foramen. There is another foramen called as the greater palatine, that is different. So we are more interested in lesser palatine nerve, and we want to stimulate it and make uvula more active. The uvula is hanging, it should be more active if we stimulate the lesser palatine nerve. Okay, for that we can place a electrode there and sensor outside and measure how much movement is there, what is the pressure of the air, and what are the movements. So we are going to train. This is not we are just anything. We are trying. We are aiming to use sensor and placing sensor and electrode. So a implanted electrode. That is electrode is need not be placed over the uvula. It can be placed over the hard palate where the lesser palatine nerve comes. See, already in Parkinsonism, a great research had come because Parkinsonism gait, they will be walking like a robotic walk. Even autism children walk like a robot, step by step, step by step. For that, they have implanted the electrode in the spine and a sensor in the both side of the legs. So they'll able to measure and monitor the walking of the Parkinsonism individual, and they are able to improve the gait also using this type of implanted electrode in the spine and sensor in the leg. So the sensor will sense, that's all, what is happening there. Another electrode is there. So same thing, I'm just thinking, why not we do the same thing? We will implant so our electrode in the hot palate, because there are a lot of electrodes they can be able to implant in the tooth. Now we see, originally our idea, the research started some 7 years back. Implantable hearing aid. That is what first our research, our own Siva ENT research. Because the hearing aid can be placed in the tooth. If the patient is having a severe conductive hearing loss, the transmitted sound to the ear can go to the tooth, can go to the ear directly. I hope I am clear. You can place the hearing aid in the tooth, and from the tooth the information will go to the inner ear and patient will be able to hear well. This is called tooth anchored hearing aid. Even now we are using this vibration training for tinnitus purine. So this will make the noise and match with the tinnitus. See, Acoustic Society of America, I have presented the paper and all has appreciated very well in case of tinnitus. But we are not able to continue this process because there are a lot of changes happening in the auditory cortex which should be measured. That is a very, very tough job. See, all functional MRI, we know, we are able to read how much the tumor is there. But what are the frequency happen, what is the measurement, all the thing, as doctors we are not able to do. It should be developed by acoustic society people. Definitely they are superior, but still our contact, our relation with them in the treatment of puberphonia is not strong enough. So similarly, what happened, this implant and all the thing, the technician will have more knowledge than the doctors. That is what required. Because we are more concentrating on treatment on patient, but the technicians will have more idea what are the changes happening when you use these sensors or instrumentation. So for that, there are a lot of professors are there willing to help me to find out and how the sensor. Sensor means just sense what is happening, that's all. If you show your hand, the water will come or water will stop, that's all. These more sensors are there in oral cavity or any other exposed place. They are able to have more sensors and they are able to make more improvement in treatment. So this had brought a great light on our treatment of using the sensor for assessing the function of the uvula. because from basic thing we want to go, because we want to prove uvula is the speech organ, uvula is the organ for treatment for puberphonia, not the vocal cord. So this fundamentally we are touching the topic. That is the biggest controversial, or it is not a controversial, it is a development. Science is will go on develop one. So this I want to do great experiment. So placing the electrode and stimulating the nerve supply of the uvula and assess with the sensor which is placed outside or inside the oral cavity what are the changes happening, what are the effects that occur in the oral cavity, nasal cavity, in the pharynx, below the vocal cord, above the vocal cord, anterior vocal cord. So all these places. Similarly, we should find out in the uvula also. Posterior to the uvula, anterior to the uvula, below the uvula, above the uvula. See, these are all not assessed even internationally. So we should have a very great cooperation between the sensor making people and ENT surgeons, especially we Siva. We need. So this message today is we are spreading. If somebody is interested in developing sensor, because see, if I want to purchase a sensor, immediately it is not available in Chennai. That is the another great drawback. We have to tell the people they will get from Mumbai. So we don't know what are the capacity of the sensor they have got it. So we have to send back. All these things are going on. So Chennai, the electronic item available, but not directly. It is available from Mumbai only. Mumbai also the requested sensor, it should be available from Japan or America. That is another problem. Radar system is well developed in Japan. So we have to go to Japan to know the radar system. Radar system is very important. See, nowadays if you go to a tire shop to fill up air for your car, they won't measure each tire at all. They will put the car in a platform. In the machine will immediately tell how much air is there. So that amount of sensors are there in all shops. But medical field, see, ophthalmology has improved a great. Dental had improved a great. In my feeling, I want to develop our field, and this sensors has to be introduced into the speech therapy. So this will not only see, this will give a feedback. That is our very, very important in our topic. So the amount of feedback you get in the computer, so it will be recorded and it will be a live session for you and evidence for you and the patient and to the world. So such a thing I want to create. That is what my intention today. So I am more extensively studying. See, I want to stimulate the uvula from outside. Sensors are there. Outside stimulation we can do for each and every muscles. So similarly, uvula is inside. But dental surgeons are more electronically developed more than Siva. I don't know other centers in Mumbai whether electronically or sensors they are using. But facial-maxillary surgeons, a part of dental surgeons, they are having lot of resources in the modern computerization and even virtual reality images, because they want to develop a face which is what expected by them. So virtual reality had come great development in denture fixation and the shape of the maxilla, mandible, and other thing. So we have to get a good support from dental doctors. And another thing is 3D pictures, 3D animation. That also very greatly developed in dental field. In any fracture of the facial-maxillary region, they immediately do 3D animation. Then only they will take it for surgical corrections, because they want to have a perfect thing in the facial-maxillary surgery. So similarly, I know rhinoplasty had improved a lot. Probably they may use the 3D animation picture of the nose also. Because see what happened in rhinoplasty, we want to correct the nose also, size and shape, but the cavity should be good. The breathing should be good. It should not produce a blocked nasal cavity resulting in snoring or atrophy or atrophic rhinitis or or resulting in sinusitis. All that is problem. Probably they may have used the 3D visualization of what is they are going to achieve after surgery. So that amount of mathematical calculation is there for uvula movement in speech recognition and speech pathology. So when we correct puberphonia, doctors are very much interested that this treatment should be done for puberphonia, because after puberphonia, their life is pathetic. It is not because of the hormonal or psychological or anything like that, because it is only the friends make them pity that they are having puberphonia voice and make them more inferior. But if they are able to resist, they will become normal. But it is our duty to treat each and every puberphonia, and luckily we are able to achieve in our circle. But it should be done uh, worldwide. Yes, they are not taking care. So I want to prove that our treatment is some way it is helpful in treating puberphonia, because lot of methods are there. Still we feel uvula is the organ we have to treat, and we have to make it all right, and we have to increase the strength, increase the vibration, thereby the puberphonia voice can be corrected. Because why, what is the importance of our essence or the master of our therapy is we are not doing any surgery at all. Though the resultant voice is what God had given to them, they will get it. Because most of the boys they will recognize their voice is similar to their father. What a great thing they are having. So by this Saturday, I am calling if some scientist interested in making sensors all over the world, please try to contact me. My phone number, WhatsApp number is 98410557774. So I want to be associate with them and do a physiological study what had happened to the vocal tract. So is it mutated in puberphonia or a hormone problem? No, definitely it is not a hormone problem. It is a genetic? No. So it is only a mutated one. Repeatedly I am telling, if you make head voice, try to create a head voice for puberphonia, they will become normal. But there is also a lot controversy. What is meant by head voice? What is meant by chest voice and other thing? So all the things will be solved. And another important factor, because I want to say lastly only, many people are now asking me, can you able to, you are changing voice having ladies voice. Similarly, can you able to change ladies having male voice? That research I am not so far trying. The future will tell. First, we have to solve this puberphonia. My intention is eradicate puberphonia completely. And for that, I want the help of all the ENT surgeons. They will help me, provided I am able to prove that uvula is the major organ to be treatment for puberphonia. Thank you very much. We will meet next Saturday, the same time, 5 to 5:30. Thank you. Great. அதுக்கு முறை நல்லா இருந்தது